The Wellstar Sleep Program is one of the most comprehensive sleep programs in the Metro Atlanta region. We have 10 board-certified sleep physicians. We have 2 board-certified ENT surgeons in sleep medicine, and we work in a cooperative spirit with approaching patients' sleep disorders with options of CPAP therapy, surgical therapy. We perform in-lab sleep studies, like the setting we're in today, but we also perform home sleep testing through portable monitoring equipment that is shipped to the patient's home.
Sleep is incredibly important, and one of the larger problems that we face is sleep apnea. And there are 2 different kinds of sleep apnea: obstructive sleep apnea and central sleep apnea, both of which have an impact on heart health and also heart disease.
Sleep apnea is a condition where the airway closes repeatedly through the night, causing, on occasion, symptoms of gasping or shortness of breath. And also, this causes interruption in sleep on repeated occasions, which results in the daytime symptoms of fatigue and tiredness and sleepiness.
The things that we think about as cardiologists and sleep disorders, there are multiple different categories. There is high blood pressure, which can be caused by sleep apnea or worsened by sleep apnea. There is congestive heart failure, which certainly can be worsened by sleep apnea. And then there are heart rhythm problems, most commonly atrial fibrillation. And atrial fibrillation can both be caused by sleep apnea and also made more difficult to treat. There are a variety of different heart conditions that are affected by sleep disorders, and those are some of the most common ones that we see.
Sleep studies could be obtained in various ways. First of all, you could seek out a board-certified sleep specialist such as myself or one of my several colleagues in Wellstar. Alternatively, you could also request your primary physician or heart physician to check you for this, in the sense that they will be aware of some of the pertinent symptoms such as snoring and tiredness, and especially if you have red flag diagnoses such as very high blood pressure, congestive heart failure, heart rhythm problems, they will be alerted to your risk of sleep apnea and can help facilitate you getting a sleep study. Sadly, most cases of sleep apnea are permanent, meaning the person will have the condition lifelong. And there are some occasions, though, if people can lose enough weight, the sleep apnea may resolve, but that's the minority. The best course of treatment for sleep apnea is not an easy answer, and I say that because I tell my patients there is no ideal therapy for obstructive sleep apnea. Keep in mind, obstructive sleep apnea involves the airway collapsing, so there is no pill or tablet or medicine I can give a patient just to help them breathe through the night. And therefore, the best therapy that's turned out over the years is something called CPAP. It stands for continuous positive airway pressure. And essentially, it's a person who's just breathing the same air in the room, except it's at a little higher pressure. And that pressurized air is all it takes to prevent your airway muscles from closing off during the night of sleep. So lifestyle is crucial for patients who might be facing a diagnosis of sleep apnea or have this diagnosis. Typically, the most common risk factor for obstructive sleep apnea is being overweight. That is the strongest relationship. The more a person is overweight, the more likely they will have this condition. And other risk factors beyond that include hypertension or high blood pressure and diabetes as well. But as regards to weight gain, any efforts a person can make towards losing weight would certainly go a long way. So absolutely, lifestyle measures primarily involve eating healthier foods, exercising on a regular basis, and trying to lose the weight. And in addition to that, something I'm telling my patients a lot more in the last year or so is to try to adopt intermittent fasting that can help you achieve those goals. Leaving obstructive sleep apnea untreated can have very serious consequences. What happens during the night when a person is having repeated airway closings, meaning the diagnosis of sleep apnea, is there is frequent release of high levels of adrenaline, which is a circulating neurotransmitter or chemical that is taking its toll on the circulation. It's pounding the circulation throughout the whole body. And this is occurring on a nightly basis. And over the course of several years, it affects pretty much all our organs. However, the two most vital organs in our body, the brain and the heart, they manifest the major long-term dangers, namely stroke, congestive heart failure, heart attacks, irregular heart rhythms, and worsening of high blood pressure. CPAP therapy, once a person has acclimated and is using on a regular basis, should reverse and resolve any sleep apnea that was present before. So essentially what we're doing is normalizing the person's sleep. And with that comes the immediate manifestation that the person is waking up more refreshed because they're no longer having those nighttime interruptions. They won't be having those loud snoring noises or gasping or snorts that they might have noticed. And very importantly, but should not be forgotten, their bed partner or spouse should also expect a more peaceful night. Sadly, there is no easy option for PAP therapy. What I suggest to my patients is, if that is what is being suggested for you, it's in your best interest to become as educated as you can about PAP therapy, to learn about it, ask your doctor the questions about it, and to try to go in with a positive mindset as possible. Because the research and the studies are very clear. Patients who acclimate and adopt to PAP therapy quickly, namely within a few days to a week or so from starting, do best long term.
Exercise can definitely help your sleep. It helps you to fall asleep. It helps you to stay asleep. It's really important for weight management. And so by exercising regularly, and it doesn't have to be intense exercise. We often say 30 minutes of exercise is adequate, and it can be moderate exercise. It can be walking. It can be riding a bicycle. Anything that allows you to have aerobic activity, to burn calories, is going to be effective in making you more tired, helping you to fall asleep, and also helping to control weight.
Weight is the number one correlating risk factor for sleep apnea. So yes, the more a person is overweight, the more likely they're going to have sleep apnea, and the more likely it will be more severe. So trying to keep the weight under check and control is crucial.
Atrial fibrillation is one of the most common diagnoses that we begin to think about sleep apnea. So we know that the same things that cause atrial fibrillation, those things are hypoxia or low oxygen levels, stretching of the atrium, which is the chamber where atrial fibrillation occurs. That occurs with sleep apnea as well. And some of the higher sympathetic activation or sympathetic tone that also occurs results in high blood pressure during sleep. That also is a risk factor for atrial fibrillation. So sleep apnea and AFib are very closely related. And as I mentioned, the treatment for AFib is also it's very difficult when you have sleep apnea. So we have higher recurrence rates, more difficult to treat, and it becomes more frequent as well. Sleep apnea can make hypertension resistant, which means that when you have sleep apnea, the sympathetic activity in our bodies goes up. The sympathetic nervous system controls our blood pressure. So the higher the sympathetic activity, the higher our blood pressure is, not just when we're experiencing apnea, but throughout the course of the day. And so what we often see is that patients who have sleep apnea have high blood pressure. They have resistant high blood pressure, meaning that they require multiple medications. And we also know that when we treat the sleep apnea, it becomes easier to treat the hypertension, and sometimes we can decrease the number of medications or even potentially have patients eliminate medications.
In a nutshell, sleep is our body's time when we are recovering, restoring, and basically gearing ourselves up for the next day. During our waking hours, we're bombarded by multiple negative insults. I'm using the word insults in terms of risks that can traumatize our chromosomes, damage our chromosomes and such, and can affect our immune health in a negative way. And it is crucial to get restorative sleep. And that's why when people have poor sleep, it is one more additional risk that or a hurdle they have to overcome if they have any other illness. And put it in another way, sleep basically lifts all the boats of the body. If you think of all the boats as all our organ systems and our overall health, good sleep is just crucial to our whole health, and immunity is absolutely integral. Sleep testing being covered by insurance, that is absolutely the case. As long as appropriate documentation has been made of the risk factors and symptoms that might be displayed by the patient or reported. So again, like with most things in medicine, with the relevant documentation, yes, it is covered. If CPAP cannot be tolerated, there are other options. But firstly, I would like to point out that a lot of people get labeled as CPAP failure, and in fact, they may be able to tolerate another form of mask and positive pressure therapy. Keep in mind that CPAP stands for continuous positive airway pressure. That means you're getting a constant pressure when you're breathing in and when you're breathing out. It's the same pressure. And some patients have a hard time breathing out against that unnatural sensation of a high pressure. If a patient feels that they can't tolerate it, they're smothering, they're ripping their mask off, that might be a good indication to try them on BiPAP. The machines and the masks look the same from the outside, but the internal circuitry and guts are smarter. These devices allow the same pressure when you're breathing in, but they're smart to detect when you finished breathing in, and on your breath outwards, the unit lowers the pressure and you're not breathing out against the same resistance. So it feels much more comfortable. And many of those patients who couldn't tolerate CPAP do fine on the BiPAP. Now, that's not to say it fixes everybody. There are some folks in whom we cannot place any kind of CPAP or BiPAP, and then we have to go to the surgical options as a last resort. So there are various surgeries, but unfortunately they are considered last resort. And the simplest surgeries have overall low success. The more sophisticated advanced surgeries have potentially higher success, but they are quite invasive and quite sophisticated and quite expensive.
It's also very common when you have congestive heart failure that you have central sleep apnea. Snoring is much more associated with obstructive sleep apnea. Central sleep apnea, on the other hand, is when our brains don't send a signal for us to breathe. So, in essence, we stop breathing for an extended period of time. And so, you don't necessarily need to be snoring or have obstructive sleep apnea to have the other type of sleep apnea, central sleep apnea. And heart failure patients more commonly do have the central variety. It's just as important to treat. We also know that treating it also improves outcomes with heart failure patients.
So Wellstar has taken a very proactive approach to our patients who get tested for sleep disorders during the COVID-19 pandemic. We are asking patients to get a COVID test performed prior to their sleep study, ideally about 3 to 5 days prior to their sleep study. And as soon as the test is obtained, the sample is obtained, the patient self-quarantines and then comes in for the study, assuming the test is negative. And then the sleep test is performed. The environment itself is safe, it's sanitized. The sleep technicians, they are screened regularly, and the patient is not going to be at risk for any exposure. They're not going to be exposed to other patients or other crowds or other personnel that they might feel concerned about.